Interpretation of hepatitis B viral markers are hepatitis B DNA level, viral load, hepatitis B surface antigen in serum, hepatitis B virus infection, hepatitis B EAG, presence of viral envelope in serum. HBeAg, presence of viral envelope in serum. HBeAg, presence of viral envelope in serum. Cardinal features of leprosy include hypopigmented patches, thickened peripheral nerve, loss of cutaneous sensation, presence of AFB in smear. Infectious communicable diseases are measles, enteric fever. Features of black water fever are destruction of RBC, complication of falciparum malaria, vector-borne primary disease manifested by hemoglobinuria. Organisms used as a biological weapon are Ebola virus, Bacillus anthracis, Yersinia pestis, botulinum toxin. Yersinia pestis, botulinum toxin. PKDL, post-kala jar dermal leishmaniasis, is caused by L. donovani, is a chronic condition, happens concurrent with visceral leishmaniasis presented with hypopigmented nodule. Autoinfection occurs in Enterobius vermicularis, Hymenalepsis nana, Taenia solium. Neglected tropical diseases include dengue hemorrhagic fever, kala jar, lymphatic filariasis. Neglected tropical diseases include dengue hemorrhagic fever, kala jar, lymphatic filariasis. Vaccine preventable viral diseases are poliomyelitis, rubella. Vaccine preventable viral diseases are poliomyelitis, rubella. Antimicrobial resistance AMR is concerned with approved action plan for AMR containment in Bangladesh, prudent use of antibiotic in hospital, AMR under One Health. Virus transmitted through organ transplantation are cytomegalovirus, rhabdovirus. Sexually transmitted infections are syphilis, trachoma, gonorrhea. High risk group for sexually transmitted infection are bus drivers, homeless people. Opportunistic fungi are Candida albicans, Cryptococcus neoformans. Modes of transmission of anthrax are inhalation, skin contact, ingestion. Endemic diseases of Bangladesh include malaria, dengue, kala jar. Congenital defects may be caused by rubella, cytomegalovirus infection. Placental barrier can be crossed by T. palladium, rubella. Features of paucibacillary leprosy are body's resistance to the disease is fairly good is caused by M. leprae. DNA viruses are herpes virus, hepatitis B virus, papilloma virus. DNA viruses are herpes virus, hepatitis B virus, papilloma virus. Adverse effect of BCG vaccination are prolonged ulceration, suppurative lymphadenitis, osteomyelitis. Complications of measles are pneumonia, encephalitis, otitis media. Complications of measles are pneumonia, encephalitis, otitis media. Virus causing hemorrhagic fever are dengue virus, Ebola virus. Live attenuated vaccines are BCG, yellow fever vaccine, measles vaccine. Live attenuated vaccines are BCG, yellow fever vaccine, measles vaccine. The opportunistic infections in AIDS patient are tuberculosis, toxoplasmosis, cryptococcosis. Features of Zika virus disease are primary carrier is Aedes mosquito, causes microcephaly, red eyes. Human is the only reservoir in measles, hepatitis B virus infection. Human is the only reservoir in measles, hepatitis B virus infection. Chronic carrier state occurs in typhoid fever, hepatitis B infection, malaria. HIV is not found in saliva, urine. And positive answers are HIV is found in semen, breast milk, tears. HIV is not found in saliva, urine. Positive answers are HIV is found in semen, breast milk, tears. For prevention and control of Ebola, following issues need consideration. Killing reservoir bats. The disease can be transmitted through different ways. Vaccine was not available during last huge outbreak. Ebola patient was not detected in Bangladesh. Diarrheal disorder is a public health problem with following facts. Giardiasis in children cannot cause shunting. Entamoeba histolytica needs development in soil. ETEC causes diarrhea mainly in children. Vaccine was found to be effective against cholera. The following diseases are transmitted orofecally: enteric fever, giardiasis, hookworm infestation, entamoebiasis. Disease eradicated from Bangladesh. Disease eradicated from Bangladesh. Variola disease. The microorganism causing congenital malformation are rubella virus, Toxoplasma gondii, HIV, hepatitis B virus. Malaria in Bangladesh is a vector-borne disease, a parasitic disease. Examples of killed vaccines are hepatitis B, cholera, typhoid. Parasite enters the host by penetration through skin. Ankylostoma duodenale, Necator americans. The parasite enters the host by penetration through skin. Ankylostoma duodenale, Necator americanus. Ankylostoma duodenale, Necator americanus. Ankylostoma duodenale, Necator americanus. A mother is HBsAg positive at 32 weeks of pregnancy. What should be given to the newborn to prevent neonatal infection? Hepatitis B vaccine, immunoglobulin. Exotoxin producing bacteria are Vibrio cholera, enterotoxigenic E. coli, Corynebacterium diphtheria. Epidemiological basis for eradication of smallpox were no known extra-human reservoir, no long-term carrier of virus, lifelong immunity after recovery from the disease. Vertically transmitted diseases are hepatitis B, HIV or AIDS, malaria. Vertically transmitted diseases are hepatitis B, HIV or AIDS, malaria. Post-exposure vaccines are used in rabies, hepatitis B, tetanus. Example of zoonotic disease in Bangladesh: anthrax, rabies, kala-jar, hydatid disease. Example of zoonotic disease in Bangladesh: anthrax, rabies, kala-jar, hydatid disease. Zoonotic diseases include rabies, plague. Disease transmitted vertically are AIDS, hepatitis B, Toxoplasma gondii. The HIV virus is synergistic with Epstein-Barr virus, cytomegalovirus, herpes virus, papilloma virus, Mycobacterium tuberculosis. The HIV virus is synergistic with Epstein-Barr virus, cytomegalovirus, herpes virus, papilloma virus, Mycobacterium tuberculosis. The HIV virus is synergistic with Epstein-Barr virus, cytomegalovirus, herpes virus, papilloma virus, Mycobacterium tuberculosis. Live vaccines are BCG vaccine, measles vaccine, oral polio vaccine, cholera vaccine. Contraindication of live vaccines are leukemia, corticosteroid therapy, pregnancy. Contraindication of live vaccines are leukemia, corticosteroid therapy, pregnancy. Advantages of DOTS for TB are low cost, lower failure rate, reduce drug resistance TB bacilli, decrease morbidity. Advantages of DOTS for TB are low cost, lower failure rate, reduce drug resistance TB bacilli, decrease morbidity. Disease prevented by pentavalent vaccine are pertussis, hepatitis B, Haemophilus influenza type B. Tuberculosis is a communicable disease, bacterial disease. Bloodborne diseases are hepatitis D, malaria, syphilis. Bloodborne diseases are hepatitis D, malaria, syphilis. The vaccine preventable diseases are hepatitis A and hepatitis B. The false answers are D, C, D and E. Hepatitis C, D আর E এর কোনো ভ্যাকসিন নেই। Vertically transmitted diseases are viral hepatitis B, human immunodeficiency virus infection. Pentavalent vaccine is given for protection against following diseases: tetanus, diphtheria. Features of oral polio vaccine include provide intestinal immunity, provide humoral immunity, contraindicated in pregnancy, live attenuated vaccine. Features of oral polio vaccine include provide intestinal immunity, provide humoral immunity, contraindicated in pregnancy, live attenuated vaccine. Disease transmitted by droplet nuclei are Q fever, influenza, chickenpox. Subclinical infection occurs in mumps, rubella, measles, diphtheria. Incubation period of rabies depends on species of biting animal, mode of transmission, severity of bite, site of bite, host immunity. Incubation period of rabies depends on species of biting animal, mode of transmission, severity of bite, site of bite, host immunity. The following are the viral diseases: mumps, measles, herpes simplex. The following diseases are not caused by virus: rheumatic fever, enteric fever. The positive answers are poliomyelitis, smallpox, common cold. Pentavalent vaccines prevent the following diseases: tetanus, diphtheria. Tetanus, diphtheria. Anthrax is regarded as a exotic disease, epizootic disease, enzootic disease, wool-sorter's disease. Indications for anti-rabies treatment are unprovoked bites. The biting animal can be traced or identified. Fluorescent rabies antibody test of the brain of the biting animals are positive for rabies. AIDS is due to reduction number of helper T cell, reduction of CD4 cell. Zoonotic diseases include plague, rabies. Live vaccine include BCG, measles vaccine, oral polio vaccine. Live vaccine include BCG, measles vaccine, oral polio vaccine. The following diseases can be prevented by pentavalent vaccine: pertussis, tetanus. HIV or AIDS spreads through blood and blood products, unsafe sex, injection. Measles vaccine may be given at the age of 9 months. Anthrax is regarded as a exotic disease, epizootic disease, enzootic disease, wool-sorter's disease. Prevalence of tuberculosis infection in a community is estimated by tuberculin test, chest X-ray, sputum microscopy, sputum culture. Toxin-mediated food poisoning are due to Salmonella হবে না toxin-mediated food poisoning are due to Staphylococcus aureus, Clostridium perfringens, Clostridium botulinum. The following are the diseases for which EPI vaccines are given: tuberculosis, tetanus, hepatitis B. Sexually transmitted diseases are syphilis, gonorrhea. Early detection of breast cancer can be done by mammography, thermography. Modifiable risk factors of non-communicable disease include tobacco inhalation, physical inactivity, stress. Risk factors for heart-related illnesses are age greater than 65 years, obesity, heart and lung disease, rural residing. Risk factors for heart-related illnesses are age greater than 65 years, obesity, heart and lung diseases, rural residing. Not modifiable factors or fixed. Age increase with age, sex more in female, family history, genetic factors, personality. Modifiable risk factors for coronary heart disease are obesity, physical inactivity. Here non-modifiable factors are age, ethnicity, personality. Examples of non-communicable diseases are diabetes mellitus, coronary heart disease. Characteristics of non-communicable diseases are long incubation period, multifactorial causation, irreversible pathological change. Nice to know. Cardinal characteristics of non-communicable disease: they are permanent, they leave residual disability, they are caused by non-reversible pathological alteration, require special training of the patient for rehabilitation, may be expected to require a long period of supervision, observation or care. The following are the modifiable risk factors of coronary heart disease: obesity, moderate alcohol intake, dyslipidemia. Chronic non-communicable diseases do not have biological agent but have risk factors, are caused by non-reversible pathological alteration, have multifactorial causation and long latent period. High risk population for diabetes mellitus: persons having diabetes in their family, people who eat more but do not do physical work. The following occupations have been associated with high risk of cancer: coal mine, nickel workers, asbestos workers, beryllium workers, tobacco industry. The major killer diseases are myocardial infarction, stroke, cancers. Non-communicable diseases are diabetes mellitus, malnutrition, schizophrenia. Some exercises. What are the major killer diseases? Answers: ischemic heart disease, stroke, COPD, lower respiratory infection, influenza, pneumonia, lung cancer. What are the coronary heart diseases? Answers are angina pectoris of effort, myocardial infarction, cardiac failure, sudden death. What are the modifiable risk factors for ischemic heart disease? Answers: smoking, type A personality, dyslipidemia, hypertension, HTN, insulin resistance syndrome, type 2 diabetes mellitus with hyperglycemia, dyslipidemia, HTN leads to CAD, stroke. Characteristics of non-communicable disease. Answers are cause non-reversible pathological change, require special training for rehabilitation, require long period of supervision, observation or care. Natural history of chronic disease. Answers are multifactorial causation, long latent period, indefinite onset.